What is your favorite energy device? Hi, it's Dr. Fan here. Let's talk about surgical energy devices. There are a number of options for surgical energy devices. These work on different mechanisms and have different designed usage purposes. Allow me to introduce a few of the most common types. One of the most commonly used energy devices uses bipolar energy. Specifically, it uses the tissue response electrosurgical bipolar generator. The most well-known of these is the Ligasure by Covidien Medtronic. This device works by having a pair of jaws which bites onto tissue of intended effect. This device is designed for tissue coagulation. It involves bipolar current being passed between the jaws. A microprocessor computer unit then calculates the voltage and current to be applied based on the impedance of the tissue. This optimizes the electrical energy flow to convert to a temperature of 80 to 100 degrees Celsius on the intended target between the jaws. At this temperature, elastin and collagen form crosslinks to fuse any vessel lumens and therefore coagulate the tissue. This device then beeps when adequate coagulation has occurred. A blade between the jaws can then be activated to cut through the now coagulated tissue. There are, however, drawbacks to the use of such a device. The main one being reduced coagulation effectiveness when the jaws are charred. It is therefore important to ensure that the jaws of this device are clean between uses during the operation to ensure optimal coagulation. Another disadvantage is that because the device is designed for coagulation, it is not as effective as a dissector. The division of tissue takes time and is not time efficient for dissecting large areas such as during colon mobilization. This brings me to the next energy device, the ultrasonic dissector. The most well-known of these is the Harmonic scalpel by Ethicon J&J. This is an ultrasonic energy device that works based on vibration and friction. It contains two jaw pieces, a straight vibrating jaw, and a mobile inactive jaw. The vibrating jaw vibrates to heat up and cut through tissue. In this process, heat is generated, which also coagulates the tissue being cut. The settings reflect the number of vibrations per second, also known as hertz. A maximum setting of 5 correlates with 55,500 hertz. The higher the number of vibrations, the more efficient the cutting. However, more efficient cutting results in less efficient coagulation. So as you can see, this is primarily designed for dissection rather than coagulation and hemostasis. One disadvantage of this device is that because the active component of the jaw vibrates and heats up, there is a risk of causing thermal damage when the jaw is inadvertently placed on surrounding structures, such as bowel. It is therefore always important to be aware of the jaw positions when using this device. Another disadvantage is that it does not work well in a wet environment, and is therefore important to keep the operative field dry. So what if you want the best of both devices? Well, there are also devices which combines bipolar energy with ultrasonic energy. The most well-known of these is the Thunderbeat by Olympus. The jaws of this device contains elements of both the previously described devices. The activation button determines whether ultrasonic or bipolar energy is used. It obviously has the benefit of both energies, but the device handle is also larger to allow for the usage of both. Despite their differences, these three types of energy devices all offer cutting and coagulation, and in that respect are very similar to use. Ultimately, it is up to surgeon preferences which energy device best suits them in their operations. There is another energy device that works slightly differently to the previously mentioned devices. This is the Cavitron Ultrasonic Surgical Aspirator, or CUSA for short. The CUSA works by having ultrasonic vibrations of 23,000 Hz at the tip of the device probe. This generates ultrasonic waves which causes cavitations in the adjacent cells at the tip of the probe. This effect preferentially impacts cells high in water content, such as parenchymal cells, whilst preserving structures high in collagen content and low in water content, such as structural cells. This allows for the dissection of tissue around crucial structures such as ducts and vessels. Built into this device is a saline irrigation and aspiration system, which irrigates and aspirates around the tip of the probe to clear the cellular debris, allowing for visualization of the remaining ducts and vessels, which can then be controlled by careful ligation. CUSA is effective in the dissection of highly vascularized organs and is used primarily in neurosurgery and liver surgery. And there we have it, the most commonly used surgical energy devices. Thank you for watching. If you liked this video, please like, share, subscribe and comment for more videos.